Assalamualaikum and hi to Madam Nur Ayuni. Our group will present about North Mississippi Health Service critical success factor lead to second Baldrige Award. Topic 9. And this is our group members.
So now I would like to continue explain about the overview of case study. So, North Mississippi Health Service, or NMHS, is a large non-profit healthcare system that serves 24 rural counties in Mississippi and Alabama. So, the organization includes hospital, clinics, nursing home, and over 6,000 employees. So, North Mississippi Health Service first won the Malcolm Baldrige National Quality Award in 2006. Instead of stopping there, the organization continue improve its system, process, and workforce. So, they create a passion-focused improve department, strengthen staff involvement, and also align everything with their 5 critical success factors, which is people, service, quality, financial, and growth. After 4 years of strong improvement and better performance result, North Mississippi Health Service became the first healthcare organization in U.S. history to win the Baldrige Award twice, achieving its second award in 2000. We present about the introduction of North Mississippi Health Service case study, which the first healthcare organization in the United States to win the Malcolm Baldrige National Quality Award twice. This case study show how North Mississippi Health Service improve its performance, service, and internal system to achieve high quality of healthcare for the communities. North Mississippi Health Service operates hospital, clinic, and nursing home across 24 rural counties, and despite limited resources, it became a national example of excellence. The organization used strong leadership, clear goals, and the Baldrige criteria to guide its improvement. Through this effort, North Mississippi Health Service was able to strengthen its staff, process, and result, which led to its second Baldrige
So I will start with the first question, which is analyze the main focus of NHMS when it's received its second award. So link the answer with the award criteria outlined in the notes.
So for the answer question number 1, there are 3 main focus, which is strengthening internal system and process, and the second is empowering the workforce, and the last and the third is aligning mission, vision, and value with daily operation.
Present about the introduction of North Mississippi Health Service case study, which the first healthcare organization in the United States to win the Malcolm Baldrige National Quality Award twice. This case study show how North Mississippi Health Service improve its performance, service, and internal system to achieve high quality of healthcare for the communities. North Mississippi Health Service operates hospital, clinic, and nursing home across 24 rural counties, and despite limited resources, it became a national example of excellence. The organization used strong leadership, clear goals, and the Baldrige criteria to guide its improvement. Through this effort, North Mississippi Health Service was able to strengthen its staff, process, and result, which led to its second Baldrige
Thank you, Aida,
Award.
for explaining the first main focus. Next, I will move to the second main focus, which is empowering the workforce. Empowering the workforce in the case study clearly shows that when NHMS established a system-wide, patient-focused improvement department in 2008, and it played a strong emphasis on empowering frontline staff to become day-to-day drive of quality, supported by system and process that allow them to measure success and stay aligned with the organization mission, visions, and 5 criteria success factor. This directly linked to the Malcolm Baldrige Award, which is human resource focused criteria 5, which evaluate how an organization work system, workforce environment, and HR practice support performance excellence. The human resource focused criterion examines such as workforce engagement, capability building, alignment to strategy objective, and creating a supportive environment for the employee to perform effectively. NHMS demonstrates this by empowering its staff, fostering strong engagement, and building systems that allow all employees at all levels to take ownership of quality improvement, and ultimately contributing to the organization scoring in the highest possible band for the workforce focus category and securing its second Bagresh Award.
My name is Nur Aisha binti Yusri. So I will present the third main focus of North Mississippi Health Service. It is align its mission, vision and value with daily operation. In the case study, it is stated that North Mississippi Health Service use its 5 critical success factors, which is people maintain high quality performance. The second is service improve customer service. The third is quality improve prevention and health education service, improve health outcome. Second last is financial produce financial resources required to support mission and vision. And the last is grow, expand to help service to drive every phase of its operation, and that this factor had the organization know that it is achieve its mission and vision value. The CEO also explained that many organizations cannot prove they achieve their mission, but North Mississippi Health Service create system and process that allow frontliner staff to measure success every day, showing clear alignment between mission and daily work. This link to leadership because leaders are responsible for guiding the organization based on mission and value, and North Mississippi Health Service leader do this by always ensure the mission is connect to goals, action and staff responsible. It's also linked It's also linked to strategic planning because the critical success factor as a strategic objective, then guiding planning, decision making and performance measure. North Mississippi Health Service show that strong leadership, direction and effective strategic planning work together to ensure the mission, vision and value are translated into daily operation throughout the entire health system.
So we move to the next one, which is question number 2. How it is possible to relate these criteria with Malaysian public hospital and polyclinic? So we move to the first one, which is the leadership. Leadership is the foundations of the Baldrige framework, emphasizing how leaders guide an organization's mission, directions, and culture. In Malaysia, leadership in public healthcare is highly structured and reflects these principles. The Ministry of the Health, led by the Director Generals of Health, provide a clear national directions on a quality, safety, and patient-focused care. At the hospital level, leadership's responsibility are held by the hospital directors and heads of the department. These leaderships ensure that clinical governance systems are functioning, quality audits are conducted, and risk management activities are embedded into everyday operation. For example, Hospital Sultan Abdul Halim conducts a daily briefings, review adverse event through root causes analysis, and leads the continuous quality improvement, or known as CQI, initiative, all of which mirror the Baldrige focus on promoting accountability and performance excellence. Similarly, leadership plays a central role in polyclinic or clinics. Klinik kesihatan are usually led by a medical officer in charge who manage a service flow, community program, staff disciplines, and the patient's education initiative. For instance, Klinik Kesihatan Pendang redesigns its service flows by reducing waiting time by using a digital transformations system, which clears evidence of the leadership-driven improvements. Consistent with the Baldrige principle, strategy planning is deeply embedded in healthcare reform through the 12th Malaysia Plan, the National Strategic Plan for Non-Communicable Disease, and the Digital Health Blueprint. These national plans reflect the Baldrige principles by identifying the future challenge such as the aging populations, increased chronic disease and the need for the digital transformations and developing a long-term response to them. Hospitals apply the strategic planning through their annual operating plans or known as AOP where they identify a local population's needs and allocate the resources accordingly. For example, Hospital Sultana Bahia, or known as Hospital Sultana Bahia in Alostar, integrates the departmental performance indicators, manpower plannings, and also the infrastructure development into its annual strategic plan to ensure a service aligned with the patient's demands. Polyclinic or clinic also conduct a strategic planning based on the local community needs. A total of 156 health clinics in Malaysia have been equipped with a cloud-based content management system or known as CCMS with 70% of the patients being treated in less than 30 minutes. This will enhance the management service by implementing an appointment-based system for a diabetes and hypertension patients. The third one is the customer focus. The Baldrige customer focus criterion stress that the patient needs should drive a service design, communications, and improvement. Malaysia Public Healthcare demonstrate a strong alignment through formal mechanism for gathering a patient feedback, such as the patient certification survey, or known as CISPA, online complaint system, service counter, and digital feedback kiosk, which are located in hospitals and klinik kesihatan in Malaysia. These tools allow patients to express a concerns which are then reviewed and used to improve the service processes. Reducing a waiting time, a common patient's concern, is a major focus in both hospitals and polyclinic. For example, Hospital Kuala Lumpur enhanced its customer focus by introducing an electronic queue system, self-registration kiosk, and appointment-based specialist visit to manage a high patient's volume more efficiently. The hospital also create a priority counters for elderly patients, pregnant mothers, and persons with disabilities. The fourth one is the knowledge measurements. Baldrige emphasized the need for organizations to use accurate data for decision making, continuous improvement, and knowledge sharing. The Malaysian healthcare system exemplifies this through extensive data reporting, national audit, and digital tools. The Ministry of Health compiles the national data through the health indicator reports, national waiting time audit, and the disease surveillance system such as MySejahtera and e-notifikasi. This dataset guide a policy decision, budget allocations, and operational improvement. At the hospital level, facilities use a various digital system such as Imaging System Hospital, Information System, HIS, Electronic Laboratory System, and PACS to monitor a performance indicators like bed occupancy rate, surgical complications, infections rates, and medications errors. Hospitals such as Hospital Selayang and Raja Permaisuri Bainon Hospital use a real-time dashboard in their emergency department to track a congestion level and adjust the staffing, which an applications of the Baldrige emphasize on the data-driven operations.
So the next point for the question number 2 is workforce focus. So Baldrige category 5 stress how an organization manage its workforce to achieve the high quality performance. For Malaysian hospital, this directly relate to ensure healthcare professionals are competent, motivated, and continuously improving. How it relates to Malaysia Public Hospital and Polyclinic? The first one is continuous professional development. So, all healthcare workers under the Ministry of Health, including doctor, nurse, pharmacist, and medical assistant, are required to earn a set number of CPD points each year. So, this ensure they stay updated with new medical procedure guideline technology, and patient management strategy. And CPD help to avoid outdated practice, reduce medical error, and increase consistency in service delivery. The second explanation is structured training and upskilling.
Hospitals such as Hospital Kuala Lumpur or Hospital Sultanah Aminah regularly conduct workshop, trauma course, infection control training and emergency simulation. Polyclinic conduct short course like training, chronic disease management update. For the example, diabetes, hypertension, and minor procedure skill enhancement. So, for the third explanation is workforce well-being and safety. MOH implement guideline to staff, schedule occupational safety, mental health support, and vaccination. For the example, hepatitis B. The focus is on reducing burnout and maintaining red lines, especially in high pressure department such as ED, ICU, maternity. So the next point is point number C, which is operations management. Belgrade category C focus on how organization design, manage and improve their work process. So, how it relates to Malaysian public hospital and polyclinic? So the explanation number 1 is digitalizations of clinical process. EMR, e-hospital. Hospital like HKL and Institusi Kanser Negara are piloting electronic medical record or EMR. So the benefit is faster access to patient history, reducing duplicate tests, improve accuracy in diagnosis and medications order. And the explanation number 2 is EQ system in polyclinic. Many klinik kesihatan use automatic queue system to reduce congestions. And patient receive number electronically, and some clinic even use mobile apps or QR code. This reduce long line and improve patient flow efficiency. So the third explanation is standard clinic pathway. Hospital follow national clinical protocol. For the example, diabetes management, dengue management with ensure consistent and safe patient care across all facilities. And this avoid variations in treatment quality. So for the explanation number 4 is infection prevention and control system. Hospital implement strict hand hygiene audit, isolation procedure and sterilization practice. IPC perform in monitor monthly to reduce hospital accurate infections. So for the explanation number 5 is pharmacy process optimization. Automate drug dispensing machine in some hospital, drive-through pharmacy system to reduce waiting time for chronic medication pickup. So the next is point number 7 in question number 2, which is the result. Belgrade category 7 assess how an organization perform in key areas such as service quality, workforce result, operational effectiveness and financial performance. So, how it relates to Malaysian public hospital or polyclinic? The first explanation is the national KPI and annual reporting. MOH publish Health Fact Malaysia and Health Indicator yearly. This report include patient waiting time, bed occupancy rate, material and infect mortality rate, surgical outcome, infection rate. And the second explanation is patient certification score. So, public hospital monitor patient complaint, waiting room feedback and certification survey. For the example, many facility measure waiting time in emergency department, pharmacy waiting time, cleanliness score, and competency and professionalism of staff. So the third explanation is clinical outcome measure. Hospital mortality rate, readmissions rate, complication rate, for the example, surgical infection. This help evaluate the quality of care and area need improvement. The explanation number 4 is financial and resource utilization. And although service subsidies, MOH track the efficiency of speeding on, such as medication use, equipment maintenance, staff, bed turnover, and lastly is high efficiency means better service with minimal wastage.
In conclusion, the NHMS case clearly demonstrates how a rural healthcare organization can achieve an outstanding performance when guided by a strong leadership, strategic clarity, and commitment to continuous improvement. By strengthening its internal system and empowering its workforce and aligning its missions and vision with daily operation, NHMS successful meet the expectations of the Markham-Bagresh criteria and earn its second nationality award. This same as the principal leadership, strategic planning, customer-focused measurement, workforce development, operational excellence and result are equally to relevant to Malaysia public hospital and polyclinic. When applied effectively, the Bagresh framework can support better service delivery, improve patient care and stronger organisation performance across the healthcare sector. Overall, the NHMS experience proof that excellence is attainable when organisation build a strong system, engage its people and consistently measure and improve its performance.